the storm, riders on the storm. Into this house we're born, into this world we're thrown.
Thank you for joining us today for this webcast. I'm Chris Martin. Some physicians and physical therapy providers can still remember the good old days. Not that long ago, healthcare providers would treat their patients, and in return, they would be paid for their services in full and on time, either by the patients themselves or the insurance companies who covered them. Sounds like a novel idea, doesn't it? But today, the situation has changed dramatically. Now, medical and therapy providers have had to shift their time and energy toward collecting payments for services rendered and away from patient treatment and care. That's not something that any treatment provider wants. Chasing down insurance companies and trying to squeeze out delinquent payments is not the reason why anyone got into healthcare in the first place. So is this the way it will always be? Is this the future of healthcare in the new decade? Maybe not. Today I'm here with David Macolino, the president of Billing Dynamix LLC, who may have a solution to many of the current problems facing healthcare providers. David, thanks for being with us today.
Thanks for having me, Chris.
All right, so tell me a little bit about the problem that you were solving.
Well, I consider this problem something analogous to the perfect storm. If you remember, back in 1991, a storm hit the east coast of the United States, and it was considered the perfect storm because of three weather patterns in the Atlantic Ocean that converged. Each one of them by themselves may not have caused any significant damage, but the combination of these three proved deadly and caused significant damage to the northeast coast of the United States. Physical therapy clinics across the country are experiencing very similar conditions. The conditions that make up this type of perfect storm include: 1, the global economic downturn, government control, which include inflation and annual Medicare adjustments, the exponentially rising insurance premiums, and underpaying insurance companies.
Okay, so there's got to be broad implications to such a storm. What exactly are they?
The Bureau of Labor Statistics reports an overall lower income across all healthcare specialties, including physical therapy. This means physicians and physical therapists have to work harder just to stay at the same level as their previous earnings.
You mentioned lower income. What specifically can you tell us about declining reimbursements?
Well, both physicians and physical therapists are suffering in multiple ways. First, as most medical professionals know, reimbursements have been shrinking for years, and they will continue to do so. Second, an ongoing trend is that insurance premiums beat inflation every year, yet provider reimbursements are not keeping pace with inflation. In some specialties, the gap is actually widening very rapidly. Third, patients are not as proactive as they used to be in seeking out care.
So how does it affect the patient behavior, and what does it have to do with reimbursement?
That's a great question, Chris. A recent Forrester study found that as many as 1 out of 3 patients skip or delay their treatment because of this economic downturn. They feel reluctant to seek out care because of their out-of-pocket expense.
So you also mentioned insurance company behavior as one of the factors contributing to this perfect storm. What exactly do you mean?
What I mean is the increasing and aging accounts receivable for practice owners. For example, the likelihood of a claims payment shrinks by 1% every day, and so payments that are older than 120 days will almost certainly never be paid at all from Medicare or commercial payers. But also, 17.7% of the accounts receivable for an average physical therapy practice is older than 120 days. So this means that 17.7% of AR older than 120 days equals almost 1 out of every 5 visits is delivered for free.
I can see how the increasing accounts receivable is a serious problem. What is the main cause for the rising AR?
Well, the main cause for the increased AR is underpayment and delays. No payment or even an underpayment for one or more procedures on a claim is very common, and that can be missed or pushed to the side to be dealt with at a later date. Usually the follow-up is too late, if at all. We can't help the global economic downturn, the exponentially rising insurance costs, or government healthcare policies. But a billing network and practice owners can work together to address 2 problems that are within their control. These are the problem of insurance underpayments and patient treatment compliance. The goal is to get physical therapists paid in full and on time.
How big is the underpayment problem for physical therapy practices?
The American Medical Association reports as high as 38% of payments are incorrectly reduced or entirely denied by insurance companies.
38%. What are the insurance companies doing to create such tremendous problems to these providers?
All right, well, first of all, insurance companies profit from what is known as the float. As much as 50% of Aetna's annual profit is derived from interest that's earned on the float. That's the money that really belongs to the providers, but is withheld by Aetna in underpayments or incorrect denials. The insurance company takes advantage of providers through the inherent billing complexity stemming from varying fees or lack of billing skills or the capability of the clinics to actually fight payers.
You said complexity. Why exactly is the billing process complex, Dave?
Primarily for three reasons. First, most outpatient clinics accept payment from multiple insurance companies. So if you work with 10 payers and typically administer 10 procedures, you potentially have 100 different price points. To overcome this complexity, providers charge a higher amount, expecting the payer to adjust the difference and pay the right amount. That's the first opportunity for the payer to over-adjust or reject the claim. Providers use archaic methods to work their accounts receivables, addressing too few underpayments too late, if at all. And then third, payers take advantage of the fact that providers lack payment volumes and tools to understand the big picture and the specifics of the wall and red tape that insurance companies have designed to deny underpayments. And those include complex billing rules, complex underpayment identification systems, complex appeal systems, and difficult help systems. But that's not enough. It's not enough that the payers underpay the providers. They also come back and take some of the money paid back for themselves through audits and reviews.
Tell me a little bit more about the audits and reviews.
The payers audit providers. They audit providers more frequently with harder scrutiny and increasingly severe penalties than they ever have in the past. Payers audit providers for regulatory compliance, correct billing practice, and for thorough clinical documentation. Audits became an important source of additional revenue for the payers. To put it into perspective, in 1993, judgments resulting in refunds to payers was around $155 million. Now, in 2006, that number grew to almost $3.1 billion. Payers use fraud as their justification, or as I call it, a wolf in sheep's clothing.
Yeah, that sounds pretty sad and frustrating. What exactly can be done about this?
Well, its solution is very simple. We actually have to take the tables and turn them back on the payers and audit them.
Really? How can you audit a payer?
Well, in 2007 in the state of California, due to a high volume of complaints, the Joint Department of Managed Healthcare and Insurance Department audited 1.1 million paid claims by Pacificare. And they discovered that 133,000 violations had occurred, of which 30% were wrongly denied claims. They fined the payers and in turn returned the money back to the providers.
Well, I see how auditing can be effective, but your example demonstrates a state auditing an insurance company. Can individual providers audit payers' payments?
Absolutely. But the challenge is that a small practice does not have the claim volume or the technology that is needed to audit one payer. You need to analyze millions of claims for one payer and discover their underpayment patterns.
How can a small provider get such huge volumes of claims needed for an audit? And how can a small provider access such very expensive technology?
Well, that's precisely what we created. We built processes, created the technology, and hired outstanding talent to level the playing field with payers. The billing network aggregates huge volumes of claims and payments across hundreds of clinics and thousands of providers across the country, and that enables us to discover patterns of underpayments and delays that payers have designed to keep the providers' money. So this allows for the creation of millions of billing rules in our scrubbing and validation engine that are used to address these issues before claims are even sent to the payer. This helps to expedite payments and ensure full payment. Since most clinics use standalone billing software and only bill their own claims, they aren't capable of leveraging the information captured from hundreds of other clinics across the country.
So, Dave, tell me about the effect of a billing network.
Very simple. It's a level playing field. We created the processes and technology that allow us to bring together hundreds of clinics and billing professionals onto the same infrastructure. To counterbalance the payer's strategic and tactical advantages, the billing network processes and systems need to enable simultaneous processing for hundreds of providers, tracking of all delays and underpayments, discovery of payers' underpayment and delay rules, systematic follow-up and correction of delays and underpayments, improve patient treatment compliance, and solve documentation problems.
It sounds impressive. How does the billing network achieve the desired results?
We address all three facets of the billing process with full-time billing specialists that includes rigorous follow-up, underpayment and delay pattern recognition. We have a highly incentivized staff, and their compensation is based on performance. Their compensation is based on collection performance. Can a clinic compensate their staff based on collections? Not likely. Technology infrastructure to work on every claim, discover every underpayment and delay, creating a massive knowledge base of payer trends, and having the ability to process millions of claims and payments every day. Also, a solid process for billing control, accountability, and transparency.
So it sounds like a good plan. How does it work in practice? What's the bottom line?
It really results in net collections increasing typically from 12% to 25%. Also, the practice grows without adding extra staff, and in some cases it can reduce its staff. It also improves the patient loyalty and treatment compliance. The days in AR are down 50% to an average of 28 to 32 days, and they also increase the compliance and lower their exposure to audits.
Sounds great. Your approach sounds simple and effective. So what exactly are the specific products offered by Billing Dynamix?
Well, we have two basic products. We have a fully integrated practice management system that includes a web-based scheduler, documentation, and we also have an optional billing service that performs follow-up, analytics, and compliance.
All right. So going beyond billing, what else can providers do to increase revenue?
Well, first and foremost, physicians need to refer more patients to each clinic owner. We track all referrals and make sure they can provide the physician with feedback on the quality of patients they are receiving. Also, the patient must receive all the authorized care they are entitled to and need to receive better visibility. So each therapist must increase regulatory compliance and spend more time hands-on with patients and less time on administrative tasks such as documentation and billing. Billing Dynamix goes far beyond billing. It really is a relationship management tool for the patient and for the referring physician.
Okay, if our listeners want to learn more, where can they go?
They can go to our website, which is www.billingdynamix.com.
All right, David Macolino, the president of Billing Dynamix, LLC. Thanks very much for speaking with us on this webcast today.
Thank you, Chris.
In the mid-18th century, there were plenty of people in America who were dissatisfied with the status quo of the time. Many individuals felt that they were overtaxed, underrepresented, and generally mistreated. But no one person had the leverage to take on the British government, the gargantuan entity which was controlling the way things worked in America. It wasn't until thousands of individuals banded together and stood up to the regime that the balance of power changed and the lives of average citizens were improved. Today, a similar revolution is taking place in the healthcare industry. Individual health providers are joining forces through billing networks like Billing Dynamix. As a result, the balance of power regarding payments for treatment is starting to shift away from the monolithic insurance companies who pay for the services and toward the people and practices who provide them. So as we continue these efforts into the new decade, we hope that one day things will get back to the way they used to be. Thanks for joining us for this webcast today. I'm Chris Martin.